And joining us now to review the dramatic developments in the Auditor General's report today, former Ontario Deputy Minister of Health, Michael Decter. Michael, welcome back to TVO.
Thank you.
Thanks for joining us tonight. I want to just share, I guess, with you and our viewers a few bullet points from today's Auditor General report in case people haven't seen it yet. Here we go, Michael. Let's bring this up. That's Michael Smith, Director, not you. $1 billion spent on the Electronic Health Records Initiative and not much to show for it, says the Auditor General. Hundreds of millions of dollars wasted, favoritism shown when awarding contracts. 2/3 of the value of all eHealth contracts were sole sourced, not tendered. 30% of decisions were made by single individuals, contract decisions, and contracts were awarded without so-called stated deliverables. You're going to do this for that, not there. Obviously, it goes on. It's a lengthy report. The auditor doesn't paint a pretty picture. You've been inside both as a member of the board of eHealth and, of course, a guy who was a former deputy minister of health. Help our viewers understand how this kind of breakdown happens.
Okay. It's not easy. There are supposed to be checks and balances. In this case, we had the most extreme checks and balances. That is, this was eventually brought to our attention by the media and the opposition who did their jobs. And we have now had an Auditor General who's done his job in a superb way in detailing how all of this happened.
So you like the report?
I think the report is the best report I've read from an auditor in the 35 years I've been reading these things.
Because there's good concrete suggestions, is that why?
Because he makes 4 recommendations instead of 400, and because he clearly delineates where this went off the rails. And he covers not just the last 6 or 9 months, but he covers from 2000 to 2009.
Well,
he covers the 9 years.
Not a bad point to note. This did not just start under the McGuinty government. This does go back, doesn't it?
It goes back, and it took a lot of things going wrong to have this big a fiasco. And it's going to take a lot of things going right to put it back on the rails, although I'm encouraged that the Auditor General supports in his report the efforts and measures being taken.
What, in your view, is the most egregious problem that he identified?
Well, the most egregious single thing in the report, in my view, as a public servant, someone who believes in our democracy, is that he was denied access to a division of the Ministry of Health for months and eventually had to go to the deputy minister to get that access. He is an officer of the legislature, and for any public servant to stand in the way of the Auditor General is something that I couldn't even imagine. In my whole career, I can't ever recall hearing about such a thing.
Let's explain that. He went to the Ministry of Health and he said, I need access to your books, to your employees, to your everything, and they wouldn't let him in.
To the eHealth division, which came in for quite severe criticism. And he said in his press conference today, keeping me out is like painting a big red flag on an operation. He said it's happened very rarely, and it just tells me that there's something, wrong there. I was offended. I expect every member of the provincial parliament will be offended, because this isn't, somebody who's been hired to come and do this. His mandate comes as part of the democratic process. And to exercise his responsibilities, he needs access. And it isn't a question of, oh, we'll give you access to this or that. He has full access to everything. And for people to make up excuses like, oh, we don't have office space is, to me, just, shocking.
But the deputy eventually got him in. That's
yes,
how he got
the
in.
deputy, when he called the deputy, the obstacles were removed.
Tell me this. The auditor made clear in his report there was no clear strategic plan on how to implement eHealth, dating all the way back, as we said, to when the PCs were in power. Mm-hmm. How much of a factor was no clear direction from above in all of what has transpired since?
You see, I think that this thing got off to a very bad start because the people who started it in 2000 went to the government of the day and said, this is a big thing. We need to invest, I think in those days it was $1 billion, now it's $2 billion. We need to invest $1 billion. And the government, that's a big number for any government. And as you'll recall, we were just coming out of tough times. The government of the day said, well, we can't give you $1 billion. Here's $50 million. Which is a lot of money, but not against this. Go away and start working on it. So you had a whole series of annual appropriations without a plan. And I think it wasn't really until much later that, and that doesn't mean all the money was wasted. Even the Auditor General says, look, I think there was waste, but it wasn't the whole amount. There certainly are some building blocks, but there was not a plan. The closest we've come to a plan is what was announced earlier this year which is really strategic priorities. And in the last few months, at least an annual business plan has emerged.
So all that contributed.
Yes.
And yeah, you were on the board there.
I ended up in the board in the spring and was appointed as chair of the Finance and Audit Committee in May. Immediately asked everybody, what should I be worried about? Was assured that all was well. 2 weeks later, I was watching television, watched the news. News lead item was the problems at eHealth Ontario. I would say in the first couple of months, or the couple of months following that, most of the information that I received came by the media and through FOI requests, not from the management of the organization.
And why would that have been?
Well, I believe, and the auditor confirms this, that management had decided that they did not need to keep the board informed of contracting or a whole lot of other things that were going on. And the auditor details practices that would be unacceptable in any government or quasi-government organization. You cannot award contracts without tender. You cannot award contracts on the basis of favoritism or people you think are good.
All of which happened. And in fact, I want to play a clip from what he had to say today, because there was an extremely heavy reliance on outside consultants,
Yes.
maybe as much as anything I've ever seen in this kind of a thing. And let's play that clip and then come back and talk. Michael, if you would.
Found in some cases a near total reliance on consultants, especially at the ministry. We noted instances where consultants were influential in hiring other consultants, sometimes from their own firms, and sometimes at rates much higher than we considered appropriate, and some remained on extended contracts for years at a time. From an operational perspective, relying too heavily on consultants can be costly. Consultants are generally a lot more expensive than employees, and when they finish a project, they leave, often taking with them the expertise needed to maintain and operate the system they helped to develop.
So how did they get away with such a reliance on consultants?
Well, I think the bad practices started, as the auditor details, in the two predecessor organizations. You had Smart Systems for Health, you had the eHealth division of the ministry, and those were rolled together into eHealth Ontario, which was supposed to be the new start, because the government had recognized that they had two competing, somewhat warring parties, and the job wasn't getting done. And that was the right decision to create the new organization, but somehow the bad practices in terms of not tendering, sole sourcing, came with the merger, and the new team that came in, particularly the new CEO, decided that they had, on some kind of a basis of urgency, a right to override the tendering process.
That's what I want to follow up on, because Sarah Kramer has, I mean, she kept silent for a long time, but in the past few days she's really getting her point of view out there. She said that it was clearly implied from, we don't know where, Premier's office, minister, somewhere, that this puppy needs fixing. Do what you have to get it fixed, because it's a bloody mess. And so she inferred from that, okay, I'll sole source, I'll cut corners, I'll do what I have to do to get the job done. Is that fair?
Well, that is, I believe, what has been said, but that's not how the public sector operates. And it's no different if Premier said to you, Steve, you got to get down to Windsor in a hurry, and you drove down there at 180 kilometers an hour and the police stopped you. They wouldn't let you off if you said, well, the Premier told me it was urgent. You can't break all the rules because someone told you it was urgent. And I am absolutely sure, knowing the Premier and knowing Dr. Alan Hudson, that they never gave the CEO the authority to override appropriate public sector rules. And I go one further than that. One of the most, because from the time this started to unravel, I was both angry and horrified at what the detail that came out and the constant level of surprise. The government sent over in June, after the CEO left, to help us turn the place around, David Hallett, who's a deputy minister in the government responsible for procurement. It's in my whole career, I've never had the opportunity to work with someone as talented and as able to manage a procurement process. And we are tendering for things in real time. This isn't, people think tender, going to send out some big document, it's going to take years to do. That's not true. In the electronic age, which is what eHealth is supposed to be about, we have vendors listed on a digital registry. A tender can be issued, they can reply in real time. You can do business quickly. So there is no requirement to sole source out of a sense of speed.
And you, as a board member, didn't know that they were sole source contracts?
No, the whole sole sourcing came to light just as I was beginning to join the board. Well, the first instance was the eHealth division transferred over 292 consulting contracts to eHealth Ontario at the 1st of April, which is when we realized that they'd been entirely reliant.
We introduced you, of course, a former Deputy Minister of Health, but some of our viewers who've seen you here before will also remember you're a former Secretary to Cabinet when you were in Manitoba. So you know how cabinets work, you know how government, from top to bottom works. So tell us this. Reporters at the news conference that Premier McGuinty had today were saying much of this bad stuff that you are decrying and claiming to fix happened when George Smitherman was the Minister of Health, not when David Kaplan was the Minister of Health. David Kaplan's been Minister of Health for about a year and change. Most of the bad stuff happened when Smitherman was there. Kaplan's either got fired or resigned or whatever, the effect is the same. Smitherman is untouched. Is that right?
Well, the doctrine of ministerial responsibility, which some may find unfair in its application, is very clear. The minister who has waste, mismanagement, or misbehavior on his or her watch takes the fall. The minute you're that ministry, you own everything in that ministry, whether you know about it or not. Now, that convention's been bent a little in the British Parliament in the last couple of decades, but the rules are still very clear. The minister is responsible for the behavior of the ministry and everything that goes on in it. And, is there a measure of unfairness in that? Of course there is. Is David Kaplan a young minister who's now apologized and resigned for trying to fix something that he found and not getting it fixed? I think that's true, and I have great sympathy for him and great respect for his humility, but those are the rules that democratic governments of a Westminster variety live under. It's who's there when the music stops and when the spotlight goes on. So you can't, as a defense, and you can understand why this is. You would unravel a government if you started going back and trying to hold accountable people who are no longer minister, because implicit in that is that since they left, they couldn't have fixed it. The only person who can fix it, find it and fix it, is the minister of the day. So the minister of the day wears it, and the convention is that they take the responsibility for it.
Let me understand how far and how widespread the responsibility goes, though. Alan Hudson, whom you've referenced, former chairman, he's left. Sarah Kramer, she's gone. David Kaplan, the minister, he's gone. Anybody else from the board? You're a member of the board. What responsibility does the board see itself as having to have?
The board were appointed sort of sequentially, so there are, and a couple of people have left the board of their own volition. The events in question happened last fall. At that point, the board was largely Dr. Hudson and 2 public servants and I think 1 external member. And the auditor references that and sort of essentially says, that may have contributed to the events and the idea the CEO had of a mandate. Most of the rest of us joined, this year after these events. I feel responsibility. I was appointed as chair of the Finance and Audit Committee. I did everything I thought as due diligence. I met with the external auditors. They raised no red flags.
So do you want to stay on the board to try and clean it up?
I'm not a quitter. I will stay and try and clean this up. I think we're making good progress. We are tendering everything. We have thanks to David Hallett, it's very hard work. We have a business plan which pulls together the priorities, the resources, the dollars for the first time.
So this is turnable or roundable?
It's going to be a lot of hard work, and I feel, this is the worst thing I've ever seen. I've got to tell you, I have never seen something with this many things wrong. On the other hand, I do believe it's fixable. I believe we can get an electronic health record in place by 2015. I think we can spend taxpayers' dollars wisely to get there.
I got half a minute left, and I want to ask you this. Your bona fides on healthcare are pretty well known. If somebody's got a problem in healthcare, let me say it, they're probably wise to give you a shout. The Premier call you at any point during all of this, ask your advice?
No, I haven't spoken to the Premier, although I was in touch with some of his senior people when we were going through the rougher moments. And I did ask for the Cabinet Secretary to provide us with some support, and she did in terms of personnel.
If they had asked for your advice in the midst of all of this, what would you have told them?
Well, I think that many of the things have been done. I think getting the Auditor General in to do the report instead of a private sector firm that couldn't have written this report. I mean, there was some controversy about PricewaterhouseCoopers. They could not have done the work that Jim McCarter's staff did. Second thing I would now say, if asked, is I think if we're going to get this done, we've got to get it out of the partisan political realm. Rita Burek's appointment as chair was helpful. She was cabinet secretary in the Harris government. I think the Premier would be well advised to seek some names for the board from the leaders of the two opposition parties and
get it out of politics.
And say, yeah, you give us a couple of really good people. We want to get this done. It's the benefit of all Ontarians. The Premier, I think, he's apologized twice. He's shown great humility on this, and I think a very good thing for him to do would be to show some nonpartisanship. And the opposition leaders, they've made their points. They've shown, what went wrong. I think they should be part of helping solve this.
We'll keep watching and see if he listens to your advice this time. Okay. We know you had other options for places to go tonight and other media outlets, so we're grateful you spent some time with us tonight, Michael Decter. Thanks so much.